So now the stage will be Oksana's. Oksana is the keynote lecturer of our Congress. She's a professor from University in Kiev and a dear, dear friend to me for many, many years. And I'm happy, proud, touched, everything that she joins our Congress. And I'm happy to listen to your lecture. Welcome, Oksana.
Thank you very much, dear Sibyl. Dear colleagues, first of all, let me express deep gratitude to organizers and personally to Sibyl Scholz for so warm words about myself and about Ukraine. And thank you for invitation to present some facts about Ukrainian ophthalmology. And I hope at the end you will see that Ukrainian ophthalmology is a part of big European ophthalmological family. Next. Of course, the story of Ukrainian ophthalmology starts from ancient times, and Kiev Rus, much of whose cultural heritage was rightfully inherited by Ukraine, was one of the most developed states in Europe in the early Middle Ages. And monastic medicine began to develop actively in the state. And one of the most famous healer of that era, Agapit Pechersky, and he's considered the first doctor of Kiev Rus. And prominent women of Kiev Rus who were actively involved in the affairs of the state helped to acquire literature, and these are daughter of Yaroslav the Wise, Anna, who was considered the most educated woman in Europe at that time, and his granddaughter, founder of the Women's Medical School at St. Andrew's Monastery in Kiev, and Vladimir Monomak's also granddaughter, also of medical treatise. In the 14th, 15th centuries, Galicia and Volhynia became the arena of rapid changes in the development of Ukrainian history, and many Ukrainians were educated in European universities, often achieving significant success in science. Next, please. The history of Imperial Saint Vladimir University, now it's called Taras Shevchenko National University of Kiev, dates back to 1833. Next. According to the approved statute of university, the medical faculty had to consist of 10 departments. Eye diseases at medical faculties of universities were studied together with surgery. And the first head of such department was Professor Karavayev. Next, he began his medical career as a resident of the St. Petersburg Military Land Hospital, and since 1834, he worked in Germany for 2 years in the clinics of famous surgeons. At that time, Karavayev met with Pirogov, who was completing his preparation for the professorship, worked at the University of Berlin at the Greffe Clinic. They will not be the beacons of not only Ukrainian, but also European surgery. In 1840, Karavayev was appointed professor of surgery at the newly opened medical faculty of the University of St. Vladimir in Kiev. And he was the first to prove the need to establish a department of eye diseases with an appropriate clinic. Later, he created and headed surgical faculty clinic of this university, and then almost 50 years until his death, he worked there. Next. Ophthalmology interested him from a young age, and arriving in Kiev even before the opening of the surgical clinic of the university, Karavayev did many different eye operations, and these such interventions as cataract removal, the formation of artificial pupil, operations for strabismus, and so on. He was the first who introduced into practice the incision of cornea in the upper part during cataract removal. And all these operations required great skill and sophisticated surgical technique. The first department of eye diseases appeared in 1818, simultaneously at the University of Vienna and St. Petersburg, and 50 years later, it appeared in Kharkiv and Kiev universities. The decision to open the Department of Ophthalmology in Kiev University was made in 1869, and prior to that, the course of theoretical ophthalmology was taught at lectures on theoretical surgery by Professor Becker and Gubenet and others. They laid the foundation and traditions of national ophthalmology. In 1852, Gubernet brought an eye mirror to Kiev from a trip abroad, which was invented in 1851 by the famous German physicist Hermann Helmholtz. Thus, ophthalmoscopy, as the most important method of eye examination, developed in Kiev almost simultaneously with Western Europe. It should be noted that Gubernet maintained close scientific contacts with the famous Viennese ophthalmologist Ferdinand Alt, and he wrote a review article on the state of ophthalmic care in Europe. Next, please. Professor Ivanov, the first director of the main clinic of Kiev University and the founder of pathological anatomy in ophthalmology. His work is devoted to the microscopic anatomy of all eye tissues, and his works received the highest score abroad, where were also printed. He had an excellent reputation as a general practitioner, and Professor Brekke said that Ivanov alone did more for the pathological anatomy of the eye than all the others put together. Next. In 1881, the department, ophthalmological department, was headed by Professor Hodin. Earlier, during the overseas business trip, lasted 2.5 years, he visited the most famous ophthalmological clinics in Western Europe and also was engaged in special research in some offices and clinics. 3 years later, he founded the first in Russian Imperial Special Journal, Bulletin of Ophthalmology, and for 20 years he was the publisher, editor, and proofreader and chief of this publication. Next. In the beginning of 20th century, the department was headed by Professor Szymanowski. For the first time in the world, in 1911, he performed an anterior eye transplant on 3 patients, an operation that still is extraordinary. This operation became the background of modern transplantology. He pointed to the possibility of using for transplantation a corpse cornea stored at low temperature. And summing up his work in the field of corneal transplantation, he drew conclusions that were far ahead of that time. Next, please. This is another prominent Ukrainian ophthalmologist that was the first head of ophthalmological department in Kharkiv, Professor Hirschman. After graduating from university, he acquired knowledge from well-known European ophthalmologists, and after returning, he defended his thesis of Doctor of Medicine on the topic of color perception. Among the Ukrainian surgeons who worked in the field of ophthalmology, one should especially highlight this person who gained European fame not only as a virtuoso surgeon, but also as a man of the highest moral principles and humanist. The City Duma awarded him the title of Honorary Citizen of Kharkov, and the clinical hospital built for him at the beginning of 20th century using voluntary donations bear his name. He took an active part in the organization of the Women's Medical Institute, and at his initiative, the Kharkiv Department for the Care of the Blind was opened and School for Blind Children was established. Next. Another prominent person is Mikhailo Kors. He studied medicine at the University of Krakow. Since he had deep knowledge not only in medicine but also in other areas such as literature, history, geography, and so on, his friends called him a walking encyclopedia. And he dealt with the humanitarian issues with regard to Ukrainian prisoners of war and internees. He had a private medical practice as an ophthalmologist, and in the beginning of 20s, he co-established the Ukrainian Medical Society, which included Ukrainian doctors from Eastern Galicia. Next, please. His articles focused mostly on providing health information to the public, particularly concerning visual health. Next, please. Professor Emanuel Emmerich Macher. Professor Macher contributed greatly to local and international medical science and was the founder of both the Lviv Eye Clinic and the ophthalmology department of the Lviv University. He studied at the University of Vienna, practicing as a volunteer doctor at the Vienna Eye Clinic, and later he left Vienna for Krakow, where he worked as clinical assistant at the Department of Ophthalmology. Along this way, he completed a specialization course in ophthalmology at the Heidelberg University, under the supervision of Professor Otto Becker. Professor Machek became a head of the Department of Ophthalmology at the Lviv General Hospital, and at the same year, the National Department appointed him as a delegate to the Imperial and Royal Council in Healthcare. Patients practically from all over Europe were receiving treatment at the Lviv clinic. Next, please. According to statistics reported by Nagel in the 1890s, the clinic was ranked 4th in the world for the number of eye surgeries performed annually and was outranked only by Berlin, Amsterdam, and New York clinics. Machek co-founded the Polish Journal of Biological and Medical Science and the Advances in Ophthalmology, and he was head of Lviv Medical Society, the head and honorary member of Galician Medical Association, member of Krakow Medical Association, and co-initiator of Polish ophthalmology congresses. Next. The Odessa ophthalmologist Vladimir Filatov gained world fame, and in 1912 he conducted his first operation with corneal transplantation. And although the operation was unsuccessful, the doctor did not despair, and he understood that he was just beginning the chosen path. And 20 years later, he made an operation that became a revolutionary discovery. For the first time in the history of medicine, he transplanted the donor cornea of the eyes from the corpse and restored his sight patient. This time, keratoplasty has stopped to be a clinical experiment and has become an effective means of restoring sight to the blind people. And whole epoch in plastic surgery was the method of skin plastic surgery proposed by Filatov with the help of round stem. From the moment of its foundation until the end of his life, he headed Odessa Institute of Eye Diseases and Tissue Therapy, which named was after him. Next, please. Next person that played huge role in development of not only Ukrainian ophthalmology is Professor Sergeyenko. In the late 70s, he constructed an intraocular lens of his own design, Gymnast. At first, he made the lens in his kitchen and home, and later the lens was professionally manufactured and successfully implanted in patients. He was invited to demonstrate surgery in Russia, Croatia, Hungary. In 1986, he delivered a lecture on the issues of intraocular correction at the Buenos Aires University. And after the exhibition, his lenses, already patented in the USA, Italy, Poland, were permitted to be exported. He designed a new type of diamond operating knife for radial keratectomy, which led to thousands of outpatient keratectomies per year. Next, please. He wrote more than 500 scientific papers, and in the 1990s, the team of the former defense industry workers from Kiev headed a laser weapon specialist, and with Sergeyenko, who was a medical consultant on the project, created the first aberrometer. The aberrometer got the name Tracy and was manufactured in the USA according to Ukrainian patents. Next, please. In nowadays, medical training in Ukraine is provided by 9 state universities. Next, please. The supply of medical specialists in Ukraine is close to the average number of in the European unity. Next, please. Eye care to Ukrainian population is provided by more than 3,000 ophthalmologists. Next. Previously, they are women and they are young. Next, please. Eye care in Ukraine, we have to stress that the bed funding ophthalmological service is decreasing, and now mostly it's outpatient departments. Next. In the structure of the prevalence of diseases, we see that myopia is at the first place, and the next is the disease of conjunctive and cataract. And if we look, next please, if you look at the causes of blindness in Ukraine, we will see that it changed greatly during last period. Glaucoma and retinal diseases, unfortunately, today are in the first place, and this situation is the same in whole the world. Next, please. Eye surgery.
Oksana,
Yes.
just a second. I think we got a little bit lost in the slides. Is this
Okay,
the
because
correct?
I can't see you. Okay, I will stop. Just please put slide number 25.
Ich habe da keine Zahlen, aber Moment. Which is number 25? I don't see this exactly. I don't see the number of slide.
Eye surgery.
Ah, this one. Okay.
Eye surgery. Okay, shortly. And eye surgery of glaucoma and cataract are presented at this slide. You will see amount of surgery in outpatient department and hospitals. And to my mind, we can do much more, especially in cataract surgery. Next, please. High level of competition, rapid development of private medicine is background for continuous professional development of specialists. And previous year, when we were preparing our Congress, we learned how many clinics are in the biggest cities in Europe with full complex, and refractive surgery and vitreoretinal surgery. And we see that Kiev had 8 clinics, but today it's already 10 private clinics, big clinics that give eye care to our patients. And this is huge stimulus for development of our specialists. Next, please. There are 3 journals in Ukraine where our scientists and our doctors can publish their scientific thesis and scientific papers, and we invite you as well. Next, please. Our specialists organize huge work in prevention of blindness, and we take part in Glaucoma Week and World Sight Day. It was few days ago as well, and give a lot of and organize a lot of screening procedures and in radio, TV, and so on. Next, please. Ukrainian Alliance of Ophthalmologists. This is professional unity, and it plays an active role in scientific and professional education of Ukrainian ophthalmologists. Annually, we organize the biggest ophthalmological congress that is called Ophthalmic Hub. And last year, it was organized in a cooperation with ECRS. Next, please. After 2 weeks, it will be held also in Kiev, and we will be glad to meet our friends from Germany and other countries, once in Kiev virtually, or much better lively. Next, please. So now I think that you see that Ukrainian ophthalmology is a part of European professional family, and we are looking forward for future cooperation and development our connections. Vielen Dank. Thank you.
Thank you so much, Oksana, for your great presentation. And I miss Ukraine a lot, I miss Kiev a lot, but most of all, I miss you a lot. And the cooperation, all our talks and the meetings with you and the time spent with you. And I'm feeling so sorry that it's not possible to travel to Ukraine this autumn. And I keep my fingers crossed that we are back soon again. So thank you very much.